Okay, let's go. So in today's video, we're going to be talking about sciatica and our main recommendation of what exercise you could do from home. This one particular exercise that works for sciatica, works really well for sciatica and lower back pain in general. And I'll also do a bit of a demonstration. We've actually got the video on screen today, so we're going to go through that with you sort of in person. And the reason we wanted to take the time to do this was because all too often people are looking through YouTube or online, seeing different exercises, and they just see the exercise in that sort of test tube environment and don't necessarily know why to do the exercise, etc. And we want to take time to actually allow you to understand why you're doing this, what it's doing, and how it's applicable to you instead of other exercises, and why some of those other ones might not necessarily be the best sort of exercises for lower back pain or sciatica. So first and foremost, just to sort of cover what exactly sciatica is, it's coming from the lower back. It's where in those lower lumbar discs or lower lumbar segments, discs might be irritated or other structures might be irritated, and there's inflammation or other things that are putting pressure on that nerve, the rootlets of the sciatic nerve, and that can give you pain down the leg. It can also give you back pain, it can vary, etc. But it's a lumbar problem. And if you've seen any of our other videos, you know that that's generally, in the overwhelming majority of cases, caused by compression through the lumbar spine, resulting in that injury. So this particular exercise we're going to talk about today is really there to unload, to decompress the spine, to allow it to get a breathing space. And I'll start by sort of covering some of the exercises that you might have done before, two in particular, and explain why this one's better. So the first one we've mentioned time and time again is the knee hug, or those sorts of stretches, which involve us having a forward bend through the spine to put a longitudinal stretch through those back muscles. And the main reason for this not being a good one is because you're invariably, you've got a stress where the structures on the back have pulled apart, and the process of healing is this side of the wound and this side of the wound trying to come back together. And when you're doing that forward bending stretch, you're just pulling them open even more. And it's almost like getting that cut on your hand, which I've used in examples before, and it's trying to go this way, and you're deciding to stretch it by pulling it out like that. It's just not going to encourage that healing process, that knitting together of the injury. So this forward bend is misguided in most places, in most cases, and you have to take a step back to look at the philosophy behind that. Why is that stretch being given? Well, it's been given to deal with muscle spasm in the back, and to deal with muscle spasm in the back, that's fine, but it's just treating muscle spasm as the core problem, rather than taking a step deeper and saying, why are those muscles in the back spasming, and what effectively can we do to stop them spasming, and treat that rather than just the muscle spasm. So that's why people get given knee hugs as a classic example when it comes to things like sciatica. The other variation is a little bit more along the right lines, and that's going to be backward bend, or sort of I think it's a cobra position in yoga, where you're on your front and you arch back up. And this as well can unfortunately be problematic. And I'll show you the right stretch to do in a moment. But with that backward bend, we're just going like that. There's no decompressive effect. And if you've got a lot of inflammation in and around where the nerves are coming out of the spine, the lateral recesses or the foramina, intervertebral foramina, then as you bend backwards, you actually close that space, which is why you get a little bit of pain at the same time sometimes, and can actually aggravate the nerve irritation. Even though that's kind of ish okay, it's much better than doing the forward bend. It can be a little bit more pointed in terms of the pain that you actually experience when you do that sort of cobra stretch. So this next one, which I'm going to go through on screen with you now, is actually an awful lot more effective. So this is the lumbar towel exercise. What you can see on the screen here is you're taking that lower back and you're lifting it up, placing this rolled up towel at the base of the spine. You can see on the screen that you're actually arching over that towel, and it's creating this fulcrum, this pivot in the middle of the lumbar spine, so all the discs can stretch out. The lumbar spine can be elongated in that position, and that's really important. And then obviously you can check this video out on our YouTube. You've got to get off correctly afterwards. That's really important as well, so you're not twisting. And you do this for around about 3 to 5 minutes a couple of times a day. It works really, really well. You've got to be careful with that one in terms of how you get up afterwards. That's really, really important. You don't want to be bending forwards afterwards, because that's going to put pressure back onto those discs. But I'll show you what I mean in terms of how it works. Clara, if you pass me the band.
Yeah. There you go.
Awesome. So I couldn't think of a better way to do this exercise, so you're going to have to not laugh too much when we do this. But if you think of this as your lower back. Now, when we do a a backward bend, for example, we're basically taking the lower back, the distance between my fingers is fixed. We're just going like that. The distance hasn't changed. The length of the cable hasn't really changed any. It's still the same. We're just bent backwards in an effort to take pressure off the discs. Now, when we do the towel stretch, we're using a pull on either end. And what's essentially happening is if my head is the towel, we are pulling down with gravity. And now all of a sudden, the distance between A and B has increased. Now, that's the benefit of the towel. All of those structures in there have had a gentle stretch going through them because gravity is pulling down on either end, both above and underneath the towel. And that creates that stretch throughout the spine equally. So unlike the backward bend, which is only going to arguably stretch the front, and the forward bend, which is only going to stretch the muscles on the back, this actually decompresses everything at the same time, therefore taking pressure off your discs, taking pressure off your facets, taking pressure off your lumbar muscles as well, all at the same time. And it's a small decompression, so it just takes enough pressure off without it aggravating or irritating anything too aggressively. And that really is the beauty of this particular stretch, because nothing else can really do that for you. So whether you've got a disc bulge, a muscle spasm, or sciatica, it can really help deal with the underlying cause of that problem, and is a really effective way of relieving some of that discomfort. Now, if you're in a lot of pain right now, then actually the pressure on the back might be a bit uncomfortable, but it's worthwhile doing repeatedly, and maybe doing a bit of icing immediately afterwards to just help take the pressure properly off those discs and off those load bearing structures. But this really is one of our sort of favorite exercises for the lower back. It's a great way to really decompress, and really the only way you can do it at home to decompress the spine. Now, there's a similar variation for the neck that is also on the website, using a slightly smaller towel. Obviously, the neck is not as long as the lower back, and that's good to do as well. I'd like to make the one distinction. There are a lot of devices that you can use at home, more so for the neck than the lower back, but where you kind of throw something over the door frame and it stretches your neck like that. A straight stretch is not quite as good as the pivoted stretch, and the reason for that is that when we actually do this, the structures on the front stretch a little bit more than the structures on the back of the spine, and that's the natural way it should be. There should be more distance on the front portion of your vertebra, particularly the anterior longitudinal ligament, than there should be on the ligaments on the back part of the spine, and that helps maintain this natural smooth curve. So that's a little bit of why we prefer that than the straight hang your head off the door frame sort of exercises that you might have seen online. So that's really important in understanding why you're doing these exercises. But I hope this video has at least explained a little bit about why we recommend this exercise, why it's better than some of the other ones, and also some of those other variations and how they're maybe not quite as good as this one. So have we got any other questions?
Yeah,
pretty much it for that.
Fiona on Instagram is asking, I think I've tapped a nerve this morning, and now I'm struggling to stand upright. Is it better to try and keep moving or to rest it?
Yeah, so I'm imagining that you haven't done anything too arduous or too challenging to trap the nerve. Maybe you've woken up like that, gotten out of bed funny perhaps. It would be very dangerous to just lie down and do nothing, because what's going to happen in the lower back is it needs movement to actually get rid of some of those waste products. The best thing you can do, this exercise for like 3 to 5 minutes max, and then getting off, but also a little bit of walking with as good a posture as you can. What I mentioned earlier in this video about those little nerve spaces closing up, that nerve is going to be trapped in there, possibly just from excess inflammation and an abnormal response. Think about how big your ankle might swell up when you sprain it in a minor way. Well, that's happening in an enclosed environment in your spine, so you're going to find it quite difficult to straighten up. But it's better that you do straighten up and just slowly move around, maybe with a bit of support from your hands, leaning on things in an upright position for short, very, very short periods. But movement is better than no movement for you. Trying this little towel exercise as well, avoiding any excessive forward bending, even though that's going to be the position that you'll try and get into to create more space in that area for the inflammation to fill up. But that's going to be a downward spiral if you allow that to take place. So do the towel exercise, do the icing. Maybe you do that a couple more than just 3 times today. Get on top of it and just try and keep moving a little bit as well. That would be the best bit of advice for that.
Fiona just said yes, just painting and decorating. Well, yes, I may have slept funny. Thank you.
Don't use heat. Please don't use heat. That will make you worse. Don't do that.
Just on a side note, the guys watching on Instagram wouldn't have seen the video when you showed it on the screen.
Yeah.
So do you mind just showing Fiona with a towel?
Yeah, sure. So we've got essentially rolled up towel about this size, and then we can actually even post it on the story later today. and then you're finding the two bony bits at the base of your spine here, and then the towel just goes just on top, and that just creates this arch for your lower back. And you're led on your back, your knees should be bent and your feet on the floor, and it just creates this little arch rather than being flat and round like so. It just creates this little arch to the lower back, and you're lying on the floor over that way. I definitely will post a little video of it on the story after the live. So check that out later today. That'll be helpful.
Fiona.
You might have noticed I had that towel behind my back on the chair, doing exactly the same thing. I definitely recommend that in your home setup, and even after you've done some decorating, if you're doing a lot of work, just lying on that for a few moments, even if you're feeling well, would be a good thing to do just to unload the spine.
Awesome. So thank you. Thanks, Fiona. Okay. And then a couple more questions on Facebook. Is sciatica caused by piriformis syndrome too?
So I really, unfortunately, I really do not like this as a diagnosis. I think it's a bit misguided. So when you understand the neurology of your spine, your piriformis is a very small muscle in amongst the other lateral hip rotators, your obturators, your gemelli muscles underneath the glutes. And this is controlled by your L5S1 in particular nerve root, which is in the bottom part of the lumbar spine that I mentioned at the start of this video. Now, if you have an irritation or an inflammation or an injury at the L5S1, it's completely common for it to refer to the glutes, so you get glute spasm or hamstring spasm, etc. And anything that is supplied or controlled by that nerve, whether it's power, so the spasm of the muscles, or whether it's sensation, tingling, numbness, that sort of thing, can happen anywhere along the distribution of that nerve. And it could be that it's your piriformis has gone into spasm, which is doubly unhelpful for a number of anatomical reasons that I won't get into. But it's much, much better that you treat the lower back rather than try and treat piriformis. Because if piriformis is constantly getting a signal from your L5S1 to say contract to protect, which is inappropriate for the long term, then you can do all the treatment you want to the piriformis. You can poke it, you can acupuncture it, you can massage it. But at the end of that massage treatment, which may feel nice, it's still getting the signals from the lower back to say contract. So I'm not a big fan of primarily treating muscles as problems. The main area that you will get a muscle problem, a true muscle problem, is in powerlifting, where the person's gone for one rep max in a competition and they've overstrained the muscle and it's torn. You get profuse bruising. But muscles that have just gone into spasm for no reason, there is going to be a reason, and that's what you need to figure out. And in the case of things like piriformis syndrome, you need to go to the lower back and properly understand what's going on there. We do that in the clinic all the time. So it's a good question. It's a really common question, actually.
Just one other question. Are yoga stretches like the pigeon pose good for sciatica?
Okay.
I'm not sure what
I'm really sorry. I have absolutely no idea what the pigeon pose is. If you just give me one moment, we can be creative here, and I'll just have a quick look.
What is the pigeon
pose yoga. Let's have a look. Okay. So that would be, I mean, that's a really cool stretch if you can do that. So
what is it? Can you
that
explain?
particular stretch is kind of like almost like a hip flexor stretch as well. I won't be able to show everybody, but it's essentially a variation of what I would call as the cobra position, but with one leg forwards and one leg back. Just quickly doing a Google to see what that exactly is. That's the example of the backward bend that I mentioned earlier. So although that's a fine stretch, it's going to stretch some things very, very well. The extension is not the same example. That's one of these examples that I mentioned earlier, where it's not actually going to decompress the spine in the same way that the towel decompresses and elongates the spine to provide that decompressive effect. So it's a great stretch for your hips, etc. And as long as you're not getting any pain when you do it, that's all right. It's better than other yoga stretches. We find a lot of patients focus predominantly on some of the forward bending activities inside yoga. And those really want to be avoided if you've got anything like sciatica or back pain in general, apart from a very few circumstances. And based on the huge number of x-rays and images and patients that we've seen over the years with back pain, those cases are very, very minute in terms of the number of the population that affects. That's just our experience. Any other questions?
Yeah, if you are suffering with lower back pain or sciatica,
have
you got any sleeping positions that you recommend?
Yeah, so one of the common ones, well, there's a few. The two main ones, my favorite one is really going to be on your side, neck support. Obviously, we don't want neck pain, with a pillow between the knees. The reason for that one is it takes off the glute tension and the piriformis we mentioned earlier and other lateral hip rotators. It takes a bit of tension off those, and that tension comes off the lower back as well. So that's a really nice one for you to do. works very, very well, and often really helps a lot of people with back pain or sciatica find relief. If you've got sciatica on one leg or one side, then it might be worth doing it on one side versus the other. If you're a lady with particularly wide hips and particularly narrow waist, you can double that up and make it even better by putting a smaller pillow in the gap here to make sure that your spine's straight and not twisted like that. So that can work really, really well as sort of an enhancement of that exercise for certain body types. And then the next one that often helps people, we see this with the decompression, the IDD table in our clinic. When you pop, so you're lying on your back and you have some pillows underneath the knees, so the knees are bent and feet down, or even properly elevated like they're on a tabletop. That's a really nice one that helps a lot of people. There are issues with that for longer periods, but if it helps you sleep, the most important thing when you've got a back pain is you have an injury, your body needs to recover. The best time that we go through recovery and healing and everything is at night. So you really want to try and find the most comfortable position to sleep in. And although there are a few downsides with that second position I mentioned on your back with the knees up, if it helps you sleep, then you should definitely do that. Any others?
Awesome. I was just going to say, do you want to let people know about the free
Yeah, of course.
section on the membership site,
Yeah,
and
so
then the virtual consultations too?
Yeah, I mean, if you're struggling with any back pain yourself right now as you're watching this video, then by all means check out our free membership area. That's there. It's got some really basic exercises to help you sort of when you're in crisis, some specific exercises, some advice, sort of going along the points that I've discussed, and much, much more. There's also a premium version to that where you've got other additional information to really help you on the recovery process, sort of more medium and long term. So that's awesome. And then also we've got our virtual consultations. We've done a couple of those today. Just helping people through video conferences, which has been quite helpful.
Also, the exercise bands that people have been asking about.
Yep. Yeah, we've got a limited number of those though.
Yeah.
So we
haven't got any of those. Exercise
okay, yeah, we've got a couple of the exercise bands as well.
So,
yeah. So if you do want those, we'll put a link in the description if we're on Facebook or YouTube, and you can get those if when it's gone, it's gone. We've had we don't have many of those. So if you can get them, they're great. They're a really awesome way for you to stay in shape, as we've discussed in previous live videos. So any other comments or anything like that on any of the socials?
Let me have a look. No, I think that's it. We are good.
Awesome. Well, I hope you guys found this interesting, and we definitely love to hear your feedback. If you found it the sort of the more interactive on YouTube and Facebook way of doing this one with the video inside the video, any comments, do please put them in the description, and we'll see you again on Monday. Have a great weekend, and if you do need any help or have any questions, then as you say, contact us on here on the social network that you're watching, and look forward to seeing you on the next live. Take care, guys.